Welcome to our Health Insights podcast on rickets, as per the Indian Academy of Pediatrics guidelines introduced in 2022.
I am honored to join you and share detailed insights on the definition, classification, clinical features, and management of rickets.
Let us begin with the basics. How is rickets defined in these guidelines?
Rickets is defined as a metabolic bone disorder in growing children, characterized by improper or delayed mineralization before the epiphyses fuse.
What are the primary causes of rickets highlighted in the guidelines?
The predominant causes include nutritional deficiencies of vitamin D and calcium, as well as issues with phosphate, leading to calcipenic and phosphopenic forms of rickets.
Can you explain how nutritional and non-nutritional rickets are classified?
Nutritional rickets results mainly from inadequate vitamin D or calcium intake and exposure to sunlight, while non-nutritional forms may arise from inborn errors of vitamin D metabolism or renal tubular disorders affecting phosphate reabsorption.
Let us discuss the clinical features. What symptoms do children with rickets commonly display?
In infants, rickets often presents with hypocalcemic seizures, whereas older children may demonstrate delayed motor milestones and skeletal deformities like bowed legs.
What are the noticeable physical signs during a clinical examination?
Signs include a soft skull with frontal bossing, delayed closure of the fontanelles, rachitic rosary along the chest, wrist widening, and distinctive leg deformities.
Which diagnostic tests are recommended to confirm a case of rickets?
The initial investigations include basic biochemical tests, such as serum calcium, phosphate, alkaline phosphatase, and creatinine, along with a careful clinical history and physical examination.
How do radiological examinations contribute to the diagnosis?
X-rays of the wrist or knee are used to identify widened growth plates, osteopenia and metaphyseal cupping, splaying and fraying, which support the diagnosis.
In what ways do the biochemical profiles vary among different types of rickets?
For instance, in vitamin D deficiency, one sees low calcium and phosphate with elevated alkaline phosphatase and parathyroid hormone levels, while other forms exhibit unique patterns based on the underlying defect.
What management approach is advised for nutritional rickets?
Nutritional rickets is managed primarily with vitamin D supplementation, accompanied by calcium, ensuring that dosing is appropriate to avoid toxicity.
How is non-nutritional rickets managed according to the guidelines?
Management of non-nutritional rickets may involve the use of oral phosphate and calcitriol, particularly in conditions like hypophosphatemic rickets or vitamin D-dependent rickets.
Could you further elaborate on the dosing differences between vitamin D and calcitriol in these conditions?
Certainly, vitamin D-dependent rickets type 1 is treated with calcitriol at specified doses, along with calcium supplementation, whereas type 2 may require much higher doses of calcitriol with either intravenous or high-dose oral calcium interventions.
What provisions do the guidelines offer to handle vitamin D toxicity?
Vitamin D toxicity is managed by promptly discontinuing vitamin D intake, ensuring proper hydration, administering diuretics, and in some cases using steroids to control hypercalcemia.
What are the specific recommendations for vitamin D supplementation in infants?
All infants from birth to 1 year should receive 400 IU of vitamin D daily irrespective of their feeding mode to prevent deficiency.
How is sunlight exposure incorporated into the prevention strategy for rickets?
The guidelines advise that infants receive 17 to 30 minutes of sunlight exposure and older children about 30 to 45 minutes during midday hours, with around 15 to 40% of the body surface area exposed.
What role does dietary intake play in the prevention of rickets?
Adequate nutrition, including sufficient calcium and vitamin D from dietary sources, alongside proper sunlight exposure, is essential for preventing vitamin D deficiency rickets.
Are there particular precautions for children with high risk factors?
Yes, children with conditions such as cerebral palsy, neuromuscular disorders, chronic kidney or liver diseases require routine vitamin D supplementation as part of their management plan.
How do the guidelines differentiate between various biochemical parameters in rickets?
They provide a detailed comparison of serum calcium, phosphate, alkaline phosphatase, parathyroid hormone, and vitamin D metabolite levels, which vary depending on whether the cause is nutritional or due to metabolic or renal issues.
What practical aspects should clinicians remember when supplementing with calcium?
It is important to use preparations like calcium carbonate with food for maximum bioavailability and to monitor the dosing carefully to avoid complications.
How does the approach differ when addressing suspected malabsorption in non-nutritional rickets?
In cases where malabsorption is ruled out and there is no improvement after supplementation, alternative diagnoses should be considered and further specialized investigations are warranted.
Do the guidelines mention any special considerations regarding the timing of meals and supplementation?
They clearly state that vitamin D replacement is unrelated to meal timings, though calcium supplements are best taken with food to enhance absorption.
Could you comment on the use of high-dose vitamin D regimens in young children?
High-dose vitamin D regimens, such as the STOS therapy, are generally avoided in very young children to prevent the risks of hypercalcemia and hypercalciuria.
What are the key messages for parents and caregivers from these guidelines?
Ensuring adequate routine supplementation in infancy, balanced nutrition, and adequate sunlight exposure are the cornerstones of preventing rickets in children.
How do these guidelines impact overall public health strategies regarding childhood bone health?
They provide a framework for early diagnosis, appropriate management, and effective prevention measures, which together can significantly reduce the burden of rickets among children.
In summary, what are the most important takeaways from the IAP guidelines for rickets?
The guidelines emphasize early recognition through clinical, biochemical, and radiological evaluations, followed by targeted management with vitamin D, calcium, and phosphate supplements as required, while also prioritizing prevention through nutrition and sunlight exposure.
Thank you for this comprehensive discussion and clarification on the guidelines.
It was a pleasure discussing these key aspects and providing clarity on the management strategies for rickets. Thank you for listening to our podcast, and we hope you gained valuable insights from this discussion.